Hi, I'm Dr. Jeff Cohen. I'm a cardiovascular surgeon at MedStar Heart and Vascular Institute. It's hard to pinpoint one thing that I love the most about being a cardiovascular surgeon. In the end, it's always about the ability and really the privilege of honestly saving one's life. What I find most interesting about the heart is that it's essentially the only organ in our body that by definition, never stops for 85 years or 90 years. And I think that's an incredible thing. It's incredibly rewarding to see how much better they feel after being able to fix, whether it's a problem with the valve in the heart, whether it's, a blockage in an artery. So it's not just fixing an organ, you're treating their whole body and they feel so much better. Within cardiovascular surgery, my areas of sort of subspecialty are both aortic surgery, which is operating on the aorta, the main artery that comes out of the heart, and also performing a lot of structural heart intervention. We're nowadays able to do a lot of work, particularly on the valves of the heart, without ever making an incision. And we do that a lot of times in conjunction with our interventional cardiology colleagues, and we approach it very much as a heart team. My patient care philosophy is to be 100% available to my patients, and that's 24/7, 365, to be honest with you. For many of them, it's the biggest decision of their life, and the biggest moment of their life, biggest moment of their family's life. And if we're going to have that privilege and responsibility to perform that operation, then it's not just about doing the surgery. We have to be available before the operation to answer any questions, alleviate any concerns. And then after the surgery, it's both being intimately involved in the care of the patient, communicating with the family, and like I said, just being accessible. I think that's one of the scariest and most difficult things for a patient and their family is just not being able to get in touch and able to navigate what is in reality a very complex healthcare system. So my goal is always to just simplify that. If we provide a phone number, call this number, you can get in touch with us, period. When I wake up in the morning, I swear to you, I'm excited every day. I really, really look forward to coming here. Honestly, I always think it's a little bit surreal that I'm walking into the hospital and maybe in an hour and a half we'll be looking at someone's heart and fixing a valve or bypassing an artery or replacing an aorta. And it's kind of a miracle that we're able to do that, and and then maybe 6 hours after that the patient's awake and we're having a conversation and they're FaceTiming with their family. So it's a pretty incredible thing to kind of wake up and do that every day.